So good evening, lovely souls, and warm welcome back to this platform of Tuesday Talks, all about past life regression therapy with me in collaboration with Joining Hands. And I'm happy to see all of you here back and excited to share with you all another topic. As some of you may be aware, and some of you are getting aware, that we have these weekly talks on different aspects of hypnotherapy and regression therapy. To be precise, past life regression. So it's all about past life regression. It just came to me, it's hypnotherapy, because today's talk is about difference between hypnotherapy and past life regression therapy. And there's a lot of confusion around when it comes to people questioning what is it, how is it, same, different. And so it's there in my subconscious and it just came up like a slip of tongue. Before we go ahead with that, very quick review, because these talks are in sync more or less with, it's going in a flow from where we started. We started with what is past life regression. We have this on a video recorded session on the Joining Hands platform, and it's on my page. Then we have why the need for past life regression, and we had different schools of past life regression in the same, taking the same line of talk as to what is past life regression vis-a-vis hypnotherapy. And before I go ahead with it, a brief introduction about me. Once again, I'm Ameeta. I'm a homeopathy doctor. Been practicing along with my homeopathy practice, integrated clinical hypnotherapy since 2004. And along with that, started learning more about regression therapy. I'm also a trainer with the clinical hypnotherapy since 2008 and regression therapy. I practice transpersonal regression therapy as well as a tasso trainer. So coming back to today's topic, and the title of this topic is the difference between hypnotherapy and past life regression. So when we talk about the difference, there is definitely a similarity, which is what one is confused with. So let me first start with just clarifying some very basic aspects about hypnotherapy and regression therapy. Going back to our talk on past life regression, we already have known regression therapy is about going back into the past. And it's not about recalling or recollecting or remembering, but reliving our past experience, which is impacting our present. And when we're talking about reliving the experience of the past, one can only relive, one can relive the experience when one have an access to that experience. And all these experiences of the past, whether it is of this life or the intrauterine or even the past life, are stored in our subconscious mind or the unconscious mind, because we are unconscious about the experiences that we've been storing as we live it. So if all these experiences are stored in the subconscious mind, that brings us to the zone of subconscious space. And hypnotherapy is about utilizing interventions, therapeutic and diagnostic, to access the hypnotic space. So what is a hypnotic space or a hypnotic state? It's a state of altered awareness. Altered because it's a little different from the state of awake and sleep. For some of you who is absolutely new to this topic, it's a little variant of the awake state and the variant from a sleep-like state. It's in between. It's a sleep-like state, but you are awake, if I put it in one line. And that's the zone of the hypnotic state of the mind, which is almost like being in a state of meditative trance, which allows one to access the zone of the subconscious mind. So can you now see the similarity of the hypnotherapy and the regression therapy? So many a times it is overlapping simply for this reason, because both of them access the subconscious or the unconscious. And the therapeutic interventions are done at that level. When we talk about hypnotherapy, it's a very broader terminology to all the therapeutic interventions, and I also include the diagnostic interventions to access the subconscious zone. If I have to put it very vaguely, it's like opening up the abdomen to diagnose or maybe treat what is not okay inside. We all have heard about the word laparotomy, right? When the surgeon says, I think I don't know what is exactly happening, but let's have a laparotomy. These days, there is laparoscopic opening of the abdomen to look into which part is not okay. So when you're simply opening up something which is subconscious, which is not in your conscious awareness, or it is totally unconscious, and everything that is done is the hypnotherapy approach. Now, why am I going so slowly and systematically? Because some of you have this little scare about this word hypnosis. Hypnosis is simply a state of altered awareness where you are in a state of trance, and the trance can be different for different people. And accessing the trance for therapeutic purpose is absolutely safe and systematic. And that's what falls in the domain of hypnotherapy, which means it can include giving some suggestions for you to start making a change in your life. You know, many of those vision board exercises where you have affirmations, and if you are taught self-hypnosis, you can actually go into your hypnotic state and bring a change by giving auto-suggestion or ask the therapist to do it. So that's one of the most conventional intervention in the hypnotherapy world. So hypnotherapy involves a huge, I would say, basket of tools and techniques, starting from suggestive work, then actually exploring your present and looking into if there are anything by way of your current situation, working with your relationships, working with your belief systems, working with some issues around your relationship in the ongoing state or in the ongoing state. Interventions to treat your pain in the present and exploring it to the source of the pain is now slowly going from the present to the past. So the hypnotherapy has a wide spectrum of modalities, working with painful conditions, fearful conditions, doing suggestive work, exploring belief systems, changing your belief systems. At the same time, once you have been able to access that state, getting to the source of it by having a regression approach. So regression by itself or by default will access the subconscious space. Yes. So now we are slowly coming to where it goes a little different. Regression is like a very laser specific approach because it only indicates going back into the past, which is influencing the present. The route it uses, or by default, if one has to make a change in the past, it has to access the subconscious, which has all the experiences embedded. I use the word embedded because they are all soaked in. So we are meeting Tuesday after Tuesday after Tuesday. Some of you are regularly here and your experiences are soaked in, right? And not everything is recallable unless something really impacts you and it kind of remains in your space, either in a positive way or a negative way. And if something has to be explored, we go through a reliving route. Now, the reliving route is regressing into the past, accessing the zone of subconscious, because that gives you a complete exploration of that experience. Slowly, the subconscious starts opening up to make it alive. because only then can you recall, and not recall, but relive it. So trance is a default route for regression therapy. So hypnosis or a hypnotic state is inbuilt whenever you conduct a regression therapy. If some of you have attended my last topic, which was schools of past life regression therapy, I did introduce to you that there are different schools of regression therapy, and there are some who don't use the route of, trance, and there are some who use it. Yes, and then there are some schools we use the trance to induce a state of induction, and some of them directly induce the trance. So the school that induces the trance through induction is one of the commonly found schools, which vary from the state of the conscious awareness that you are, a certain script or certain way of induction script is introduced. So you systematically keep going. It's like, diving into the ocean and slowly going and reaching to that part that requires to be addressed for you to identify the source of the issue. So that's using the induction route. Some of you would have experienced it, where the therapist would ask you to close your eyes and read out certain details, like, close your eyes and counting you down, or using the staircase route. Yes, it seems familiar if you may have seen it on the media or heard of or experienced it. That's using the induction route. But there's also another school of past life regression, which bypasses this typical classical induction route approach. And it believes, and it's not just a belief, but it's something that we have very often found, that in exploring at the cognitive level your symptoms, your problem, and in a way to start picking it up cognitively, a therapist who's trained to find a problem which itself starts by itself inducing the trance. So they, in a way, bypass the induction way of accessing the subconscious to reach to the source of the problem, and the problem itself induces the trance. Haven't we experienced when we are in a deep agony, we are just stuck, or we are frozen, or our minds just don't think? When I say minds don't think, the conscious mind stops thinking. So we are actually slowly regressing into the moment and being stuck. So it's something on similar lines. This is just for the sake of explanation. Maybe someday, as we go further with this kind of talks, we will also have some group therapies, and you will be getting an experience of it. So the trance is induced by the problem itself, and this is also in a very, very subtle way. Now, the levels of trance may vary, but definitely it is to attain to or to reach to the source of the issue. So in short, regression therapy by default uses a trance state. A trance state is a state of hypnotic trance, and because you cannot be completely kept there and then, because then if that part of you is completely there and then your therapist cannot connect with you. So generally, either in hypnotherapy and in regression therapy, a part of your consciousness is here and now, so that you can take the instructions, and a part of it, and a large part of it, is there and then, which itself is a state of a kind of elliptical consciousness. Now, this is very essential for any regression work. So that's how it's very similar to a hypnotic state. And so many a times it is being confused whether we're doing hypnotherapy or regression therapy. But I said it's hand in glove. But at the same time, hypnotherapy is not just construed to regression therapy approach. It has a variety of interventions, starting from plain suggestive work to exploring the belief system, to talking to the subconscious mind, going and dealing with the pain, dealing with fears, or maybe working with the void inside you. Many a times you have these or working with so many addiction issues or guided visualization. Now, there are a whole lot of techniques and interventions besides the regression work in the domain of hypnotherapy. So that kind of gives you an understanding of what is similar and what is different between hypnotherapy and regression therapy. I would like to summarize one thing, and which is from my experience, that when we talk of hypnotherapy, and I see it has a wide application in both mind and body ailments, as much as it is in the regression therapy approach. People have such notions about hypnotherapy. But if you really look at it and look into your life, and if you really look into the hypnotherapy approach as getting into a trance, I would say all transformation cannot be possible without a trance. Mull over it, reflect over it this week, and feel free to drop your questions, and I'll be happy to address it. Yeah, every transformation has, or rather is possible with this subtle trance state where the shift happens for all of us. And one of the roots of our transformational work and the deep healing work is regression therapy. So it's like hand in glove. Stay tuned. Keep in touch. If you have any questions, I welcome here. I may invite Komal if she can open up or unmute people who are looking to have any queries answered. I'll take one or two right now, and with that, we can bring the end to this program. But yes, I would like to have any questions that are very, very pressing right now and address it.
Does anyone have a question?
So it seems there are no questions. That's fine. That's great. If there are any questions, you can put it on the chat box. Maybe the chat box will close now, but on my page. And we look forward to meet you back the next Tuesday with another topic, what to expect and what not to expect in a regression therapy session. So with this, we end this talk here. Thank you for this hearing and patient listening. Good luck, goodbye, good evening. See you all soon. Bye-bye.
Thank you.